We hear a lot these days about stem cell therapy. Well, exactly what is it and how can it help you? Dr. Frank Lanzasera from Total Regenerative Therapy joins me today as we begin a 4-part series on the science behind this treatment. Good to see you, doctor.
Good morning, everybody.
I know, I love talking about this because it's so fascinating. The science, I think, is moving so quickly. So I love that we're doing this 4-part series. But how do you best explain what stem cell therapy is for those maybe who have not heard about the success stories yet?
So stem cell therapy is revolutionizing the face of medicine, right? And we're able to now treat chronic conditions like arthritic joints and even help people with autoimmune disease get better quicker, with less surgery and less medication, right?
I'm really excited to hear about that. That's going to be a future one. But I think maybe one of the more common areas that this is being helped for is in the joints. We have, I know, a picture of a knee joint, which you guys are finding great success with this. But talk about if people are suffering from knee pain or any kind of joint pain, how can stem cell therapy help? What is it doing?
So we know people with chronic joint problems usually have inflammation.
Okay.
That's a given.
Yep.
So stem cells do 3 things. Essentially, they regenerate tissue. So in the knee, they can help regenerate the cartilage, the meniscus, tendons, ligaments. They help decrease inflammation, which is a major reason for people having pain. And they help improve how the immune system works. So when you do those 3 things, people can begin to get more active again, right?
Now, when you say stem cell, it is your own stem cell, correct? Explain what it is. Like, what are you injecting with?
No, so we're not using the type of stem cell therapy my integrative medical staff is using is umbilical cord stem cells. These stem cells are donated by healthy moms who have given birth to a healthy baby. And the tissue is screened according to FDA and National Institute of Health guidelines for any infectious diseases. And we're using those umbilical cells. One advantage is those cells are younger, more robust, more potent. So for example, my 4-month-old grandson, I would rather have his stem cells than my 63-year-old stem cells, right? Because they're more robust. So because we're using umbilical, there's no surgery involved. The stem cells they come frozen, they're cryopreserved, and we inject them into the joint, for example, if it's a knee problem or a shoulder, and the injection takes about 5 minutes.
Wow. And then how many injections are typically needed? Obviously, each person is going to be different, but what are you seeing as far as the success of people feeling better?
Right. So most patients will just need 1 session.
Okay. Wow.
So they're with the nurse practitioner about a half hour. She takes their history and examines them. And then the actual injection is about 5 minutes.
Is there much downtime afterwards? What do people need to know as far as recovery time after?
So they're able to get back to normal activities, but, there's always a but. So if it's a knee problem, for the first month, we don't want any heavy weight-bearing activities, light walking, and then as 4 weeks go by, they can start to increase their activity, stretching, maybe a little bit of weight training. So we want the cells to get in there and do their work. The cells are rebuilding tissue over 90 days.
Wow.
And so we want to baby the joint a little bit. They can get some physical therapy and then increase their activity gradually.
Again, this is fascinating to me. If people are watching today, whether it be, again, knee, shoulder, talk about some of the other things we're going to talk about in the upcoming episodes.
Well, we're going to talk about autoimmune disease because stem cells help to improve how the immune system works. And we are seeing evidence of benefit for MS, psoriatic arthritis, Hashimoto's thyroiditis. We'll talk more about that.
I can't wait. So looking forward to having you back. In the meantime, if you have questions, you're watching today and go, I want to know more, there's a great offer this morning for watching this segment, mentioning that you saw us, and I know there's a free consultation, but I'd imagine that's the best thing to do is just to call, get your own questions answered, correct?
Right. Go to betterstemcells.com. You can take our stem cell quiz to see if you're a good candidate.
Okay,
right? You can see upcoming seminars and then call the office and we'll get you set up.
All right. Looking forward to having you back. Thank you so much, doctor.
Thank you.